Hello, everyone. Greetings from the day. I am Priyanjali from All About Wellbeing. This is All About Skin Wellbeing, and I'm sure all of you must be keeping good health. We all know taking good care of your skin is important more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infection can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Seema M Siddhu, live from Mandya, to enlighten us on the topic of on fungal infection. Dr. Seema M Siddhu is MBBS BMC, MD PGI Chandigarh, DNB, and is currently working at Dr. Seema's Skin, Health and Cosmetic Clinic, Mandya. Today, Dr. Seema M Siddhu will share with us on fungal infection. So, doctor, over to you. And the first question we want to ask you today is, what is fungal infection?
Hi everyone, I'm Dr. Seema here. Today I'm here to create awareness about the fungal infection as it's very rampant and very common among this monsoon season. So coming to first question, what is a fungal infection? So it's a common kind of infection, especially involving the skin, hairs and nails, caused by multiple types of fungi. So it depending on the area it is affecting, it could be caused by various types of fungus.
Well, we all came to know what is fungal infection. My next question to you, doctor, would be how to take care of fungal infections and how to tackle the same.
Yeah, so basically, firstly, targeting the cause of fungal infection. Why will one acquire the fungal infection? So most common thing we have to remember is the fungus will grow wherever there is moist area. So it could be because of sweating, or it could be because of the monsoon season, or you're working in a wet environment, like especially for the toes and for the hands, for those like housewives working in kitchen all the time. So try to keep the area as dry as possible, because wherever moisture is there, it's like a ideal environment for the fungus to grow. So once it start growing, you'll start developing the itchy rashes, red rashes on the body. Most common sites will be your groin area, that is the thigh folds, and also underarms area. As we all know that this is the common sites where we sweat a lot, and then because of the friction area, the skin will also be very sensitive. So you will get the infection more commonly in these areas. And also another area is the between the toes area. It could be because of the wet work, or it could be because you're wearing shoes for long hours. That time, because of sweating, between the area toe, because of loss of aeration, there will be a lot of moisture environment, and it's ideal for fungus to grow there.
Right, doctor. So as doctor has already mentioned that monsoon is one of the season of the year where we mostly face fungal infection. Well, people, our viewers who are watching us right now, this is for you all. And now we are going to know about the treatment of fungal infection. So doctor, over to you. My next question would be, what is the treatment of fungal infections?
Yeah. So as I previously told, depending on the type of fungus, we will have different kinds of treatment. So firstly, from home, what you're supposed to do. When you are diagnosed by a dermatologist as a patient with fungal infection, first thing you have to do is that you should keep your personal items separately. Don't share your clothes, soap, towel, or combs, because all of these contain this fungus infection. Once you share with your family members, then they also can acquire the infection, since it is a very contagious infection. So importantly, along with this, your doctor will prescribe you the oral and topical antifungals, depending on your extensive lesions, or if it is there for many months or few days, depending on that, your doctor will decide. And only when after the prescription by the doctor, you are supposed to take treatment, because there are multiple creams available over the counter which has steroidal creams in them. So even though the steroid will give you immediate relief, it will not help you in killing the fungus, and that will cause more resistant kind of fungus infection. So please make sure that you visit a dermatologist if you find any kind of itchy rashes, especially in all your folds areas. And it has to be diagnosed by a dermatologist and taken treatment as advised.
So viewers, immediately reaching to your nearest dermatologist can be the solution of your fungal infection, as mentioned by doctor. And we move ahead with the next question. The next question for you, doctor, would be what antibiotics treat fungal infection? In case if anyone wants to sit at home and do not feel like going to the doctor, we can also help them out today at this platform by letting them know that what are the antibiotics which they can take immediately to treat the fungal infection.
So firstly, coming to this, in spite of, even though if it is very mild infection or it could be an extensive infection, never do home treatment for the fungal infection. It has always to be prescribed by a doctor. And even though if you are not able to go to the doctor, many doctors are available for online consultation. Please show your lesions. Don't feel shy away because the lesions are in the intimate areas. Only when you consult at the right time, we can treat you properly. And also, depending on the extent of the lesions and depending on the what sites are involved, we'll decide regarding the oral treatment are required or just topicals are required. Without the doctor consultation, please don't take any treatment.
Well, about antibiotics and about the treatment, which we just came to know that it is not at all safe to sit at your home and just come up with a medicine and take it and use it for your cure. Well informed by your doctor this day that please visit your dermatologist before taking any sort of medicine. Moving ahead with the next question. The next question would be, which is the most serious fungal infection which we see in our day-to-day lives?
So basically, majority of the fungus will cause mainly superficial infections that is involving the skin, hairs, and nails. So none of them, until unless you are very much immunocompromised or you have a nick in the area, you will not get any kind of serious infection. It will just involve the extensivity of the skin organ. So there are very few rare cases of fungal infection where it can affect your vital organs like liver or brain. But that is in mainly immunocompromised patients, those who are admitted for ICU care or in comatose patients. So it's a very rare infection. So you don't have to worry. Since you have a skin infection, it will not lead to a severe kind of infection causing any fatality. But you have to treat it because you have to stop it from spreading to your family members and friends. So that's why it's very important to treat yourself for the cutaneous infections.
Well, the next question which we have for you, doctor, I think every viewer who are watching us right now will have the same question in their mind. Why does fungal infection occur again and again? Yeah. It is a thing which everyone is facing on a day-to-day basis, that once it stops, again after a certain interval, we see it again in our skin or our body. So why does this happen?
Yeah. So basically, first thing is you have to know why it's happening for the first time. So the first time is mainly because you have not maintaining the hygiene, that take bath properly every day. And once you are sweating or you feel that you have worked out and you're sweating a lot, come back and take bath again. Keep the area always dry. So this will help in preventing the occurring first time infection. Whereas, especially when you are getting it again and again, the main common causes will be we take inappropriate treatment. Like for example, I'll start a tablet as prescribed by my doctor, and I'll feel the rashes have subsided within 2-3 days. Then I'll feel that, okay, it's gone. Why should I take oral tablets? It's not like that. Because whatever fungus is there, the fungal load, if it's, for example, 100%, you take 2-3 tablets, 2-3 days of tablets course. And then at least 20-30% of the fungus infection is killed. But whatever 70% is there, it will remain dormant in your skin. So after you stop the medications, again, 2 weeks, 3 weeks later, it will start multiplying, it will come again. So inappropriate treatment is the main cause, especially among us, because we have that idea that, oh, why should we take oral tablets? Why, since it's not appearing, it's not visible on the skin, do we have to take tablets? You should take tablets. You should always take tablets as prescribed by your doctor. Even the topical creams, till the course your doctor advises, please take till then. Don't stop it in the middle. Even though the rashes have subsided, itching has subsided, it doesn't mean that you're cured of fungus infection. And other causes will be that when you have immunocompromised state, like for example, if you are just a diabetic or you're on other immunocompromised medications like post-transplant and all, you will have lesser immunity levels. So that will prevent our body from killing the fungus. So that could be the cause where you're getting the fungus infection again and again. And also if, for example, I have got the fungus infection and my family members also have, but only I take treatment. If they are not treated well, again, I'll acquire fungus from my family members. So since it is contagious, it's always important. treat all your family members. Consult the doctor and treat at the same time so that you'll not get infection as a cross infection again and again.
Very well informed by our doctor this day. That why it arises again and again. Also, it is very important to keep your surroundings clean, and you should also make sure that the people around you, they are also maintaining the hygiene. The next question for you, doctor, would be, can I stop taking antifungal treatment if symptoms get better earlier?
Yeah, as I told just now, see, basically, itching response which we get when we get a fungus infection is our body's immunity trying to kill the fungus. So if you use a cream for time being, the itching sensation is lost, but the fungus, whatever is like 20-30% which is killed, it doesn't ensure that the rest of the fungus is also killed. So even if you don't have symptoms, even the rashes are not there, please continue the course of treatment and complete the course.
Well, all the myths in your mind are being cleared at this live today. And with that, we will quickly move on to a very important question, which is the next one. Doctor, the next question would be, can oral antifungal drugs be taken during pregnancy?
Yes, we do have safer antifungals during pregnancy, but usually we don't prescribe for all the pregnant females based on their extensivity of disease or based on the duration, based on the morphology and type of fungus, we decide the medications. And there are safer options also. You don't have to worry. Even though you are pregnant and you are having infections, please consult a dermatologist. We have safer options.
Well, we move on with the next question, and this is also another important question arising in everyone's mind, which is it safe to take antifungals long term?
Basically, we don't prescribe antifungals for long term, more than around 3 to 4 months. Depending on the disease, we taper it down based on like if it's the first episode or recurrent episode, how many lesions are there and which are the areas, and how is your immunity. Depending on that, we give safer dosage and safer duration also. So even if you're taking, for example, 2 to 3 months, we'll do your blood test monitoring. We'll see if there are any derangements, if the dose has to be reduced or if other antifungal option has to be given. So only when you're taking monitored treatment under a doctor, you're under safer advice. So you don't have to worry about the side effects.
Well, the doctor this day, she is saying it again and again that please do not take decision for yourself. Do consult expert, do consult nearest dermatologist before you come into any sort of conclusion. And now we move on with our next question, which is there a way I can prevent getting ringworm on my feet frequently?
Yeah. So as I told, the main cause for tinea pedis, we call it as ringworm between the toes, is because we are keeping the feet moist. For example, you're working in a wet environment, then keep it dry. Whenever you're working, at least wear a shoes which is like waterproof, or after working in the water, come back and mop it dry. Keep it dry as much as possible. And especially when you're going to public places, don't walk on barefoot, especially because the water is the medium for the fungus to develop. So whenever you are walking in the public pools or in the public places and all, if you're walking barefoot, there are high chances that you'll acquire infection. And also when you're wearing tight fitting shoes, especially because it's like occluding your skin surfaces, there will be a lot of sweating and lesser aeration, and that can also increase the fungus multiplication. So try to avoid tight fitting shoes. And also wear your separate slippers. Don't share your slippers or shoes with your friends or family members also.
Right, doctor. And now if I see the chat, we have a question from Mr. Gaurav Garg. He wants to ask, what can I do in future to lower my risk of getting another fungal infection?
So from your question, I can see that you have already got your fungal infection once. So to prevent the occurrence, what you have to do is take bath regularly and wash all your clothes, including your undergarments, in hot water, and dry it under the sunlight. And iron before wearing it. Make sure that you have ironed the clothes, because the heat will also destroy the fungus. Along with that, keep your towel, soap, as well as combs separately. Don't share it with any of your friends. And also, since your immunity is well, nothing to worry. We can prevent the fungal infection by taking these measures.
Doctor, if I personally have to ask you any question, it would be, what sort of food can increase the immunity? Because we are talking about immunity again and again, that how important is it to remove all the bacteria from the diseases from our body. Or what can we do in a day-to-day life to increase our immunity?
See, basically, following a healthy diet has included everything which has power to increase the immunity. Especially, we'll have to cut down on the outside food wherever we have preservatives, coloring agents, and even like sugary drinks, like all the cold drinks and all. So all of them will have this thing in ingredients which will help you, which will prevent from developing a good immunity. Okay. So when we include a lot of vegetables and fruits and nuts, especially dry fruits in your diet, all of them will have these antioxidants, which are known to boost the immune cells. Okay, by following healthy diet, you will have a very good immunity.
Right. Also, doctor, I would want to ask you this very important thing. Nowadays, we see people drinking very less water. On a day-to-day basis, even I, on my personal life, I drink very less water. How important is it? How important is water? How important is it to consume water to lead a healthy life, also to flush out all the fungus, the bacteria from our body? Is it important?
Basically, water intake is very important for maintaining a normal, healthy metabolism. But per se, for a fungal infection or any kind of bacterial infection, it will not have any effect. So you don't have to worry about it. If you are having a fungus infection, should you drink more water? Not required. You have to drink adequate 3 to 4 liters of water per day. That is enough. And this will help you in boosting the immunity and also like keeping all the body metabolism at a normal rate. So if your metabolism is right, then if your immunity is right, obviously you clear up the fungus at a faster rate.
Perfect. Right. Doctor, we have another question from Akansha Puri. She wants to ask, are there any signs that indicate the infection is getting worse or spreading? What can I do if this happens?
So based on the lesions, your doctor will see, for example, if you have a red patch in the thigh fold and you'll see the size of it is increasing or the borders of it is becoming more red or swollen, and you feel a new lesion is coming at least some 5 to 6 centimeters away from the previous lesion, these are all the indications that the infection is still spreading. It's not coming under control with the medication which has been prescribed for you. Consult your dermatologist. They'll see the disease. Depending on that, they will treat you, because once you start the medications, usually within a week to 2 weeks, you'll start noticing the lesions will disappear.
Right. We want few more questions to be coming up. If anyone wants to know anything regarding fungal infection, we have doctor here with us. With that, we have another question. We have Sonia Singh asking us, is it safe for me to use public facilities like swimming pools or gym showers while I have a fungal infection?
No, absolutely no, because it should be our responsibility that since it's a contagious disease, any kind of contagious skin infection, if you have, not only fungus, even the bacterial infection, please don't go to any kind of public swimming pools or public gyms, because we'll whatever sweat is there, whatever clothes we are wearing, even those will have fungus. Even if, for example, if I use the swimming pool and someone else comes and use the same swimming pool, from the water they can acquire it. So till you're cured of the fungus infection, don't use the public areas. That's why you have to keep everything separately till you're cured of it.
Basically, personal hygiene is what we require to eliminate fungal infection, or to take care of it, or to balance it in our body. And we have another question from Ajit Singh. He asks, is there a specific diet I should follow or avoid to help with my recovery?
As I told previously, regarding the diet, directly doesn't have correlation with any kind of fungus infection, but maintaining a healthy diet will help in like increasing the immunity, boost your immunity, and help you clear up the fungus infection. So include a lot of fresh vegetables and fruits, and also a lot of dry fruits in your diet. And adequate water intake is also very important. With this, that much will be enough for maintaining a normal metabolism in your body.
Right. Well, also, doctor, nowadays we see people are fitness freak. We see a lot of people who are very much enthusiastic towards physical fitness. With that, we have Faria Begum asking a similar sort of question, which is, can I continue my regular activities like exercise or going to work while being treated for a fungal infection?
Yes, you can continue rest of your routine as normal. until unless you keep your personal items for yourself and you're making sure that you're not sharing your items with anyone else. And even if you're like working out regularly, make sure you take bath immediately after you finish your workout and change your clothes. Even if you have worked out outside, or for example, you have roamed around, you're traveled or you're done shopping, and you come back in the evening, you feel you're more sweaty, you take bath. And try to wear cotton clothes and loose clothes as much as possible. Especially the trend is now to wear jeans all the time and also tight fitting jeans. This will have lesser aeration and it will increase the moisture in your thigh folds and increase the tendency for developing fungus infection. So try to wear loose fitting clothes, especially in your summers and monsoon season, whenever we have a higher sweating tendency.
Right. About with that, doctor, we usually know that gym wears are usually tight, body hugging clothes, what we call them in our usual language. So, as you mentioned that between the thighs for girls, also for boys, between the thighs are a very usual area to form fungal infection. So, while working out or while exercising, when there is friction, or if the person already has fungal infection and when there is friction, does it has a possibility of increasing the infection?
Absolutely. As you told already, if the patient is having infection in the thigh folds, so once you have inflammation, skin is already sensitive. So once you start doing any kind of work exercise with the tight fitting cloth, the cloth will come in middle and will increase the friction. And also if you wear tight nylon clothes, especially the gym wears are made of nylon, so it will not absorb your sweat. It will increase the sweat, and environment for fungus is very good there. Obviously, fungus infection will start increasing. Even the irritation and itching part will also increase with that. So try to wear loose fitting clothes, especially when you have fungal infection, and make sure you don't scratch also. Because once we scratch, all the fungus particles will get lodged in your nail between below the nails area. And again, you scratch some other area, then you'll lodge fungus there, you'll start developing new lesion there. So try to avoid scratching, and also make sure that whenever you have active infection, try to control its spreading also.
Okay. So moving ahead with another important question, doctor, is we happen to use public toilets. So for all the people who are working and who has to use the public toilets or office toilets on a regular basis, what are the important things which they can take care of or they can use on a daily basis?
Yeah, especially when you're using public toilets also, when you have an already infection, make sure that you take extra measures. That you have to wash your hands in hand washes separately. And also try to keep a separate tissue paper roll with you, and then try to mop the area dry and don't leave it wet. And if you feel that it's already wet, try to change the undergarments once you're back home. Don't sleep in the same undergarments also.
Right. We have another question coming up from Shivani. Shivani asks, are there any specific hygiene practices or lifestyle changes that I can help manage or prevent fungal infection?
Yeah, like daily taking bath is very much important. Along with that, try to wear as much as loose clothes, loose cotton clothes, especially when you're known that you'll be sweating a lot. And when you're traveling or when you're going for shopping where you'll sweat a lot, that time at least. And also those who have recurrent infection or those who have excessive body folds, there we can use dusting powders also, as it will help you absorb the sweat and keep the area dry. And that's an additional thing we can do. And also, especially when, for example, if you wore a cloth the day before, try to wash it before wearing it again. Don't use the same clothes, and wash all the clothes in separately in your even when we while washing the clothes also. If we mix our clothes with the infected person clothes, then also there are chances that the fungus can be acquired again. So wet it separately in hot water and wash it separately and dry it in sunlight, and also try to iron all of them before using. So all of this will help you prevent fungal infection.
Okay, so as we are repeatedly listening to this, and doctor is mentioning this again and again, that fungal infection is contagious and we must take care of our well-beings as well. With that, we have Lata Shankar asking a question. Doctor, which is the precautionary medicine we need to have to avoid fungal infection?
There is no medicine like it will prevent fungal infection. As I told you, have to take personal hygiene measures, and you'll keep the area dry and clean. So this will prevent the fungus from developing. For example, you will see a bread developing a mold. So you'll not apply any medicine for that to prevent mold. You will keep it fresh. That's how we have to keep ourselves fresh to prevent fungal infection from happening. Fungus is there everywhere. It's there in the outside environment, water, soil, everywhere. And even the pets might get involved with the fungus. So if wherever you see, for example, your own pets is having infection, try to get it treated, because touching them will get your infection. And if you're keeping yourself healthy and clean, then there are very less chances that you'll get fungal infection.
Okay, doctor, with that, I have another question for you. What are the food we can take to, eliminate fungal infection from our body? Are there any sort of food which can help us in this treatment?
Fungus infection doesn't have any direct correlation with the diet. So even if you take any specific diet, or if you're not taking any diet, like specifically like healthy diet or junk food, so both of them will have a normal whatever effect is supposed to happen on the body. Like healthy diet will give you a good metabolism and a healthy immunity, and junk food will actually impair your proper metabolism of the body. It increase the obesity chances like that. So indirectly, when you have a unhealthy diet, it will impair the body weight, obesity. All of them will in turn reduce your immunity and increase the chances of getting diabetes. That's an immunocompromised state. And again, you'll get fungus infection. Fungus infection is very common among those who have less immunity. So you'll have to follow a healthy diet, and properly hygienic measures are also very important.
Right. We have another question coming up from John Varghese. How long does it typically take for a fungal infection to clear up with treatment?
So normally we do give treatment for around 2 to 3 months. Even though lesions will disappear in the initial 15 to 20 days of treatment, we ask them to continue medications, at least the topical medications, depending on the lesional severity. So once you are like after 2 to 3 months, we'll ask them to stop. So that time we have seen that many higher number of patients will not have recurrence when you complete the course of treatment. Normally around 2 to 3 months, you'll have to follow up regularly.
Okay, well, 2 to 3 months is the time which it usually takes, but then also I think it depends on the level of infection or the amount of infection the person has. Well, with that, we have Tina Bhargav asking us, is there any over-the-counter medicine available? Is it safe?
So this is a very rampant practice in India, that there are multiple OTC products available which has a antifungal, antibacterial, and steroid combination creams. So they try to cure everything with that. So this is a very wrong way, because basically the symptoms which we get when you get fungal infection is itching. So itching is what your body is trying to tell, through that immune cells are trying to fight your fungus. So when you apply the steroidal cream, it will suppress the immunity because it's an immunosuppressive agent. So once it suppresses the immunity, you will feel the immune cells are not destroying. Obviously, you'll feel less itching. So what we feel is that, yes, our fungus infection is decreasing, so let's continue the same. But it's not like that. Along with lowering the immunity, fungus will start multiplying and proliferating more and more rampantly. Okay. So never buy an OTC product and use it, especially for fungal infection, because it's a very bad practice. And we have seen multiple cases where they have used this over-the-counter medications and come back with very extensive lesions. And that time we'll not be able to help you just with the topical and oral antifungals. Also, we'll have to give you higher medications, and it will be a long course of treatment. It's actually a very anxious and also a bothersome procedure for the patient also. Once you start using the OTC product, you'll feel useful, but immediately after, like once you stop it, it will start recurrence again and again. So please don't use OTC products.
Well, highly said by doctor that it's not prescribed to use such products. With that, doctor, another question is it possible that the fungal infection can shift from one part of the body to another?
Yes, absolutely, it can happen. As I told, it's a contagious infection. For example, if I got on my hands and I'm scratching with the other finger, so it can spread from one finger to other finger. Or else I've got on groin folds, I start scratching from the nail fold, from the under the bed of the nail, and I touch my face. So obviously it will spread to face. So it is very rampant, and if you don't treat in the initial stages, it can involve rest of the body also. We call it as tinea corporis, very extensive disease. And it can infect the nails also. If you have got nail, from the nail, it can come on the skin. So whenever you feel that there are itchy red rashes which are appearing, especially in your folds area, try to consult a doctor immediately so that we can prevent spreading, not only for the others, even for yourself. We can try to tackle the disease as early as possible.
Well, with that, I think doctor has already answered our next question, which has come up from Suhana Thakur. Suhana Thakur asks, what can I do to prevent further spread of the infection to other parts of my body or to others? Well, doctor has mentioned right now that you should definitely take care of the hygiene. Also, you should consult a doctor immediately without further delay. Uh, okay, doctor, with that, my next question would be, how can we take care of the babies? Like for the babies who does not know what to do, and they also do not know how to take care of it. Being the parents, it's not always, possible to see where the baby is going, because usually the toddlers, they crawl and they happen to eat something from the ground, and they happen to chew things what they find next to them. So what are the precautions we can take for the toddlers or for the babies?
So we have seen that like even if it's a healthy infant, you don't have to worry until unless any family members has infection. Even they scroll around the all over the ground also. If you have cleaning it every day, there are no chances that the child will get a fungus infection. Only when the child mother has it or father has it, and they obviously hug the baby. So then from skin to skin contact, there are high chances. From the fomites in an uninfected family, it's very rare. So don't worry. If you are infected and your kid, you want to prevent your kid from getting infection, make sure that it doesn't come in the skin of the baby doesn't come in contact directly with your skin lesion. And also keep all your clothes separately, wash it separately, especially baby's clothes also wash separately. And make sure that you're not using the same towels, same soaps and all. So if you avoid sharing the items, there are very less chances that the baby will get infection by this.
Well, doctor, my next question for you would be a heated up question. Regarding this question, I have heard a lot of people fighting and quarreling. We have seen that people kisses baby, when they want to adore the baby, they feel like kissing the baby. We have also seen moms, kissing the baby, and all the baby does the same. Is it safe to do so for the babies?
So basically, with respect to fungal infection, when you have a tinea faciae, when the fungus infection is there in your face and you
Right,
touch the baby, then it's absolutely no, you should not do it. And not only fungal infection, even like something called we have herpes viral infections also, where it is
right.
dormant. So with that, just by contact with the saliva, even if it is the baby's cheeks also, sometimes children will get rashes with that. It could be allergy to saliva or allergy because of the herpes infection. So it's obviously better to avoid contact, especially because the skin of the babies will be immature. They'll not have that greater immunity to fight all of them.
Right. Uh, so my next question for you would be, is fungal infection always visible to our naked eye? Can it also be hidden somewhere inside, and then we are not exactly able to detect it? Is it possible?
So basically, when we have the infection like underarms or thigh folds, because it's a sensitive area, we tend to develop itching faster. But between the toes area, or in case of great toenails being affected, especially onychomycosis, we call it. So there we don't develop any symptoms. So we tend to neglect it also, because normally no one checks their foot every time between their toes and all, unless they're washing separately and they have a lot of time. Okay. So and the fungus which develops between the toes usually doesn't cause much symptoms when it is in the initial stages. Okay, so that time it's always a good practice that whenever you're coming from outside, wash your leg completely and wipe between your toes also, and check for any of this maceration. Initially, it will start like a white patch. So check for that and check below the nails area, especially the great toe nails and those who usually grow their nails longer. So there is actually a space for the fungus to get lodged and start growing. So if you see any powdery particles between your below the nails, or if you feel that the toenail is like breaking, it's very brittle and it keeps breaking on its own, then it's high time that if you are neglecting a fungal infection, you have to contact your dermatologist.
Okay, so brittle nails can also be a reason of having fungal infection for people who have not heard of it, like I have not heard of it. Well, this can also be a reason of fungal infection. Going to a nearest dermatologist, referring from an expert can be a solution, a quick solution to your problem, as mentioned by doctor this day. Can we have any more questions coming up? Do we have any more questions coming up from our audience? Well, everyone, we are knowing an in-depth study, in-depth knowledge we are getting to know about fungal infection, which is arising on a day-to-day basis. It's extremely common. And this is the season where we usually come to see it in our body. With that, we have another question from Rahul Bastwar. He asks, what can I do to prevent further spread of the infection to other parts of my body or to others? I think doctor has already answered to this question. Um, well, doctor, do you want to add any highlights? Any highlights which we have another question. Rahul asks, Rahul adds another question to his question, which is, what are the common symptoms of fungal infection?
Okay. So answering your first question, and apart from the points which I already told, like treat your family members who are having the infection. Because if you don't get your family members treated, so even if you are cured of the disease, you might acquire from them. So the cross infection keeps happening. So that is an additional point that you have to do, even like when other families or friends are affected, because it can spread from them to you through their fomites or through skin contact or while washing clothes like that. And coming to your symptoms question, so basically it will start as a itchy red rash. Normally this we call it as ringworm. So it appears as a ring-like thing. So it will have a red border, and within the center it might be red, or it might be having the white scales kind of thing. So whenever you feel you are having these kind of lesions, you have to like get it treated. And regarding the nail infection especially, so usually we'll see that they'll have these powdery particles or thickened nails, and especially normally we see that great toenails are affected because we tend to wear tight fitting shoes and then we are not observing properly. So these are the common symptoms you have to look for.
Very informative and very clearly mentioned by our doctor the reason why it is occurring again and again and what are the symptoms of fungal infection. With that, we have Aruna A asking us, is fungal infection season specific?
So we see majority like it's very rampant and common, because even if one person gets it, it's like known that if you don't follow the personal hygiene practices, a family will get it. So it's very highly rampant among the monsoon season and summers when you sweat a lot. Other seasons usually we tend to see very lesser cases. It's not like it's doesn't happen at all, but it can happen, but in a lesser number based on your practices.
Right. So, doctor, on the basis of the question which we just received from Aruna, my question would be, what are the seasons in which we highly need to take care of our health?
Yeah, especially in summers and monsoon season, where summers because we sweat a lot, and monsoon season because we tend to get wet and we don't dry ourselves, or we tend to sleep over in the same wet clothes, or we like even if the clothes are wet, we tend to use the same clothes from morning to night time. So whenever the area is moist, it's an ideal environment for the fungus to grow. So try to keep yourself dry as much as possible. Either you have to avoid sweating in summer season or post workout and all. And in the monsoon season, use a rain jacket and try to use prevent like try to keep changing your clothes whenever it gets wet.
Well, doctor, it was a very, very informative session. And with that, I would like to ask you the last question. It's not a question. It's just that we want our viewers to take something home from this live today. So according to you, what will be the home message for every viewer which they should follow?
So basic important thing which you have to remember is that never neglect a skin disease just because it's involving skin, because it can affect your whole body and also it can spread to your family members. And even if you have got it, there is always a treatment which will help you cure it completely. So meet a dermatologist, get it cured, and try to keep yourself healthy. Like practice all the healthy practices, like as I told, daily bath, and then keep yourself wash your clothes in hot water, keep yourself dry. So practicing a healthy hygiene practices will help you in like maintaining your skin also healthy, and also your health will be very good with that.
Well, with that, we would like to thank you so much, Dr. Seema M Siddhu, for your valuable time. It has been quite an informative session for our viewers today. We look forward for many more such sessions in our coming time. Also, we would like to thank our viewers for an excellent participation. And for more information and updates on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available in YouTube, Twitter, and Instagram. Thank you and have a good day.
Thank you for having me here.